Hi, I'm Simon. I'm a GP in South Liverpool. The NHS has obviously been through some really challenging times recently, and I think my colleagues across the system have responded brilliantly to the threat of coronavirus. But now we're a little bit worried about patients who don't have coronavirus. There's been a real reduction in patients with heart attacks and strokes and severe illnesses going to our hospitals through A&E or coming to see us GPs. And we know that from surveys that quite a lot of people are reluctant to bother the NHS, or they're worried that the system might not be safe for them because of the number of patients we've been treating with coronavirus. The purpose of this video is to reassure people that the NHS remains there for emergency care, no matter what your emergency. And specifically, I want to talk about a few groups. The first one is patients presenting with chest pain that might be a heart attack. Please, if you develop severe chest pain, still ring 999. This is one of those conditions where time is of an essence, and you will still be prioritised by our fantastic ambulance service if you ring and say you've got central chest pain that feels like you're being crushed. Should that happen, ring 999 straight away, and the NHS will respond as it always has. Likewise, patients who might have a stroke, it's really important that we get treatment to them very quickly. And we've talked for a long time about the FAST algorithm, which is if patients have any type of facial drooping, that's what the F stands for. If their arm goes limp and is unable to be moved, that's the A. Or if they get any slurring of their words, then that's when time, the T, becomes of the essence. And I'd expect any patient or their carer to ring 999. You will get the same response as you would have done before the pandemic. These are emergency medical conditions that we really need to treat quickly. And we've got the safe place in hospitals to do that. Our hospitals have responded to the coronavirus pandemic and have areas where you will not be exposed to patients with the virus. So it's still the safest thing to do is ring 999. The other area that it's important to discuss are pregnant women. Maternity care is going on the way it always has. Our local trusts have just made one change, which is that we're no longer doing home births to protect staff and to protect patients. So if you're pregnant, you ring the phone line at the Women's the way you always would to book in. If you're not sure how to do that, or if you've got any queries or questions, you can contact your general practice. Children, it's really important. We've seen a massive reduction in the number of attendances at Alder Hey A&E, and that's not necessarily a bad thing. However, we're really concerned that we might be missing out on children at early stages of illness and allowing them to become more poorly before we see them. So NHS 111 remains open for things that are not COVID related. Our 85 general practices across the city are still open and can be contacted. We're not doing walk-in surgeries, we're not doing so many face-to-face consultations, but you can absolutely talk to a GP or nurse if you're worried about your children's health. And for emergencies, there's 999 and Alder Hey A&E, which are open as usual.